A new COVID variant has been found in the UK. The World Health Organization said in its latest report, the new mutant called XE may be more transmissible than any strain of COVID-19 so far, the World Health Body has said. So, is this a cause for concern? Just as we thought we were returning to normalcy, our schools are finally open again. 5 states have done away with mask mandates. Now a new variant emerges. What does this mean for India? Should we be concerned? Well, we have managed to get, thank you for your time, Dr. Soumya Swaminathan, the Chief Scientist of the WHO, the World Health Organization. Dr. Swaminathan, a lot of anxiety over this new variant, so thank you for your time tonight. WHO first reported the XE COVID-19 variant on the 22nd of March, where it stated that this variant is a recombination of the Omicron BA.1.1 and BA.2 variant. What is a recombinant?
Thank you, Sarah. I know it can be very confusing to people. And first thing I would like to say is that there's no reason to panic just now. As you know, the latest variant of concern, we have 5 variants of concern, and Omicron was the one that was the last one in November of 2021. And the Omicron variant has several sub-lineages. As you know, we've been talking about BA.1, BA.2, and there's even BA.3. And thanks to all the surveillance that's going on, and particularly the genomic sequencing that's picked up so much during this pandemic, we've been able to track the evolution of this virus. And from the beginning, we've expected this virus to keep changing and mutating, and that's what it's done. Yeah. And when we actually designate something as a variant of concern, it means that it has some differences in the properties from the previous variant. Either there are differences in terms of increased infectiousness or transmissibility, or that there are some differences in clinical patterns in the virulence, or in its immune evasion, in the fact that it's able to overcome the immunity that individuals have due to previous infection or vaccination. Now, what is recombination? Recombinants. Recombinants are when there are 2 different viruses that happen to be in the same individual, in the same cell, and bits of genetic material get exchanged between these viruses. This is again a common and a normal thing that happens during normal viral infections and evolution. Most commonly, it happens within the same family of viruses, but like within the coronaviruses. But it's also been actually determined to happen between different viruses as well. And we're learning more about this because of the increased sequencing. So this particular recombinant called the XE is basically a combination of the proteins from, or the antigens from BA.1 and BA.2. So 2 Omicron subtypes or sublineages have recombined, and that's been labeled as XE. There's also XD and XF, which are recombinants between the Delta strain and the Omicron strain. Wow. Those have been found only in a few dozen cases, whereas this particular XE has been reported in over 600 sequences, mostly from the UK. Yeah. There's an indication that it may be, say, 10% or more transmissible than the BA.2. So far, there's been no indication that it's causing more severe illness or that vaccines are not working against it. So at the moment, it's still under observation. We're tracking it closely, and we will keep making more information available as it comes.
All right. So a lot of information there, but I just want to emphasize the big takeaway. You are saying that as of now, there is no need to push a panic button. We just need to understand and study this further. So let me ask you, Ma'am Swaminathan, now we are saying we don't know whether it could be the efficacy of this virus or how strong it could be. That we don't know yet, but we do know that it is more transmissible than other COVID variants. You just said 10% more than, I think, the Omicron. So does that mean that, what does this mean for whether it can actually cause a COVID wave then?
So, we'll have to watch and see, because as you know, the BA.2 was more transmissible than the BA.1. And so in many countries that had gone through a BA.1 Omicron wave, they started seeing an uptick of cases again. In many countries in Europe today, you're seeing a lot of transmission. And BA.2 is becoming more common than BA.1 because it's even more transmissible. But the reason for the increased transmission is not just the virus. It's also the dropping of all the restrictions, the increased mixing of people, the opening up of society, of the economy, and the fact that there are still people whose immunity has either waned or who have not yet been vaccinated. Unfortunately, even in high-income countries, there's a significant proportion of people who still haven't received their vaccines. And if they are come in the vulnerable group, then you'll see them also getting sick. But what's happened in many of these countries is that there's an uncoupling between an increase in infection and hospitalizations and deaths. So even though you see huge numbers of infections today in many European countries and even in the Asia Pacific region, it's not translating into increased deaths because people have been vaccinated. And I think the lessons coming out of Hong Kong are quite important because of the fact that there the elderly groups, people over 60 and 70, and particularly over 80, had very low levels of vaccination coverage. And that is why they got really sick and their hospitals got overwhelmed. So it's not just the overall vaccine coverage in a country, but we need to look at these subpopulations and make sure that these groups, people over the age of 60, for example, that we achieve close to 100% coverage. But as long as we do that, so far the vaccines have held out against all of the variants that have come along.
So now if I can just move to talk about India specifically, how much of a concern should XE be for India? We're seeing so many cases in the UK now. How worried should India specifically be given our vaccine numbers, given our, proclivity, the way we've reacted to these viruses so far?
So I would say that we have to be cautiously optimistic and watchful. I think the key word here is that we mustn't give up on the surveillance, on the testing. Many countries have significantly reduced their testing. And then we go back to a situation where we don't know what's happening and whether new variants are emerging. So it's really important, even if the number of cases is low and clinical testing is going down, we need to maintain the surveillance so that we're able to know how much virus is circulating in the community. And we're also able to sequence a percentage of those circulating viruses to know, if there are new emerging variants. This data needs to be shared globally, of course. And if every country does that, then we can try and stay ahead of this virus. Otherwise, we'll be in a situation where we're suddenly hit by a new variant, which leads to increased, cases and hospitalization. So I think the most important thing is to continue surveillance. And the second is to have the focus on the vaccination, as I said, especially on the vulnerable groups. And the WHO now recommends a third dose of the vaccine, starting with the highest risk groups and then making your way down to cover all adults, to make sure that everybody has the best possible protective immunity to protect against future variants. We know that, immunity wanes over a period of time.
Yes.
And so that third dose, the booster dose, is important. And thirdly, to make sure that we have the tools, we now have drugs that we can treat with, we know the clinical algorithms to treat people effectively. We know that we need oxygen. We know that we will need a surge of beds if there is a wave. So we've been through all of this before, and we need to put in place a mechanism where we can quickly scale up if needed. But at the same time, I think with India's very high vaccination coverage, particularly in the older age groups, and in fact across the population now, I think that, even if there is a new variant, there should be not the kind of impact that we had seen in the past in 2021 with the Delta wave. And so I think knowing what is to be done and at the same time, preparing the health system, I think we know now where the gaps were, and addressing those gaps, both in terms of infrastructure as well as human resources, is going to be really important, because we need to do all of the other things, which some of them got neglected in the last 2 years. And there are setbacks in many of the health indicators that we've seen in non-communicable diseases and in diseases like TB, for example. We need a renewed emphasis on making sure that people are not suffering from those other ailments, while at the same time staying prepared for any future COVID variants.
All right. And lastly, I know you've touched upon this, but I just want to ask you about this specifically. What about COVID safety measures, right? We keep repeating the pandemic is clearly it's far from over. As health experts like you have been saying, we're going to have to live with this in some form or the other. That said, right now in India, at least 5 states have said that masks are no longer mandatory. What would you say about the fact that we still don't have booster doses in India made available for the adult population?
So let me address the mask question first. I think it's good to be sensible. As you said, we are not out of this pandemic. The infection is the virus is circulating in the community across the world. And we know it's a matter of time. When you see a surge in one country due to a subvariant or a new variant, you're going to get it sooner or later. There's no way of stopping it because it's just the nature of the virus. And so I think it's good to track the epidemiology. I mean, at the time when virus transmission is very low, it's okay to lift some of these measures that had been imposed in the past. But at the same time, I think it's also a question of individual, even if the mandates are lifted. I think individuals should continue to practice protective behavior, particularly if you're a vulnerable individual or if you have others in your home that are vulnerable. I, for example, would continue to wear a mask if I'm going into a crowded indoor setting, if I'm traveling by public transport in areas where the ventilation is not good. I think it's just good to take those measures. In fact, we've seen other respiratory infections go down over the last 2 years, and now we're seeing surges in influenza and in other respiratory viral infections, both in children and adults. And so it meant that all those measures we took not only reduce the risk of COVID, but other respiratory infections. So I would say let's continue to take sensible measures, and individuals should continue to protect themselves and protect others by wearing masks in situations where they're in a crowded setting. The second thing you mentioned was about boosters. I think, as I mentioned, we have immunity tends to wane over a period of time, particularly the neutralizing antibodies. The cell-mediated immune response does last for longer, thankfully, and that's the thing that protects against severe infection. So giving a third dose now has been shown in many studies to increase the level of protective immunity. It will last for longer as well, and hopefully if that's what is protecting people who are vaccinated now with 2 doses or 3 doses. It's preventing them from getting ill and ending up in the hospital. So I think, again, focusing on getting the vulnerable groups their 3rd dose, but then extending it to all adults in the country would help India be better prepared because you're building that population wall of immunity that's going to stop the virus from wreaking havoc again in the future.
Dr. Swaminathan, thank you so much for your time. Really an important, crucial day to have you on the show to help clarify all of that and assuage some anxiety here. Thank you so much.
Thank you, Sarah. Bye.
All right, the big story back home. After a landslide victory in the Punjab polls, the Aam Aadmi Party has now set its eyes on expanding its base, and they have announced that they will be contesting all 182 seats in the Gujarat elections in the home state of Prime Minister and the Home Minister Amit Shah.
केम छो? मजावा? क्या नजारा है? अंदर दिल में कुछ होता है। जब तिरंगे को देखते हैं, इतने सारे तिरंगे चारों तरफ।
Amidst a sea of tricolour, Aam Aadmi Party chief Arvind Kejriwal today blew the bugle for his next target, Gujarat polls, which are slated to happen later this year. Upbeat over its sweeping victory in Punjab, the new Chief Minister Bhagwant Mann also accompanied Kejriwal. The leaders who carried out a 2-kilometer-long roadshow or Tiranga Yatra in Ahmedabad asked Gujarat's public to give Aam Aadmi Party a chance.
अहंकार हो गया इन लोगों को 25 साल में। अब ये जनता की नहीं सुनते। एक मौका आम आदमी पार्टी को दो, जैसे पंजाब के लोगों ने दिया, जैसे दिल्ली के लोगों ने दिया। एक मौका आम आदमी पार्टी को दो, अगर हम पसंद नहीं आए तो अगली बार बदल देना। एक मौका आम आदमी पार्टी को दो, सारी पार्टियां भूल जाओगे दोस्तों। अब दिल्ली और पंजाब तो हो गया, हमारी तैयारी है गुजरात की।
Kejriwal declared last year that Aam Aadmi Party will contest all 182 Gujarat Assembly seats. AAP also performed well in the local bodies elections held in March 2021. AAP won 42 seats, 31 seats in Taluka Panchayats, 9 in municipalities and 2 district Panchayat seats. But despite these crowds, Aam Aadmi Party faces a number of challenges in Gujarat. In 2019, AAP was unable to win a single seat in Gujarat. All its 29 candidates had lost their deposits. The party faces a tough challenge from the BJP, which has a strong and wide network of ground workers. AAP lacks organizational presence in Gujarat. PM Modi continues to spearhead the campaign in Gujarat, which is his home state. The Prime Minister is set to visit Gujarat again later this month to inaugurate development projects worth over 2,400 crore rupees. But AAP workers who came from across various corners of Gujarat to Ahmedabad today said that the party will be able to change its fate this time.
केजरीवाल जी जो दिल्ली में जो सब कुछ चला रही है कि कॉलेज स्कूल वगैरह ऐसे गुजरात में होना चाहिए.
सिर्फ मुद्दों पे बात करनी है, शिक्षण पे बात करनी है, खेडूतों की जो परेशानी है, जो महंगाई है उसके बारे में बात करनी है. इसके बारे में तो कोई भी बीजेपी का कोई भी नेता हो कोई बात करने के लिए तैयार नहीं है.
जो सरकारी स्कूल है सब बंद कर दिए, सब खानगी कर दिया है. आम आदमी पार्टी ये सब कर सकती है, बीजेपी का काम नहीं है ये.
Kejriwal and Maan also visited Mahatma Gandhi's Sabarmati Ashram in Ahmedabad, where the leaders were seen spinning Gandhiji's iconic charkha. In line with AAP's focus on building a unique identity by invoking leaders and issues of India's freedom struggle. But politics over Kejriwal's visit has started already, with BJP IT cell chief Amit Malviya tweeting a video accusing the Aam Aadmi Party of bribing people to participate in its roadshow.
है भाई रैली में आया तो पैसा से ना बेचो जो भाई.
Last time the allegations that the Aam Aadmi Party leaders faced in 2017 was that its top leaders did not make their presence felt on the ground and did not boost the morale of the party workers. But this time the party leaders have hit the ground running and plan to change the fate in their favor. In Ahmedabad with camera person Sachin Gupta, this is Trivedi for NDTV.
All right, so let's take this forward now. Delhi, Punjab sorted. Next, Gujarat. AAP has sounded the poll bugle in Gujarat. Will the AAP be the new force in the Gujarat Assembly elections? Well, joining us is Mr. Isudan Gadvi, senior leader of the Aam Aadmi Party in Gujarat, and Sujata Pandey, political analyst with pro-BJP leanings. But Mr. Gadvi ji, आपको पहले first to you. आप पहली बार गुजरात में लड़े इन द 2017 असेंबली पोल्स, बट उनको एक भी सीट न जीत पाए उस समय. आपके सारे कैंडिडेट्स लॉस्ट देयर डिपॉजिट्स. व्हाट्स गोइंग टू बी डिफरेंट दिस टाइम, सर? बिकॉज दिस इज गुजरात. इट्स वेरी डिफरेंट फ्रॉम Punjab. This is a stronghold of the BJP. BJP has been ruling the state since 1995. This is the home state of the Prime Minister and the Home Minister. Mr. Gadvi? All right, let me try and get in Ms. Pandey, Sujata Pandey, and we'll try and get the line up there with Mr. Gadvi again. Sujata, AAP has already tasted, if I look at it, I can look at this picture completely differently also. They tasted their major success in the Surat municipal poll. So it's not just about winning in Delhi or winning in Punjab, but even in Gujarat, they have tasted success. They won 27 seats. They are really the principal opposition party in Gujarat. So a worry for the BJP.
Okay. So let me this has been widely circulated, Sarah, and I think it's time that I bust this myth. You know, if you see 2016 elections, the municipal elections, the Surat, the same. You know, the similar thing has happened with Congress also, when there was a rift between the Patidar community, which is around the 19% vote in Gujarat. I mean, 19% population, and as a major voters in Gujarat. The same thing has happened with in 2021 also with AAP, when they won 27 seats in the Gujarat municipal elections. But right after it, You know, when the Gandhinagar and the other two civic bodies elections were held, BJP swept it. AAP got only one seat. Okay, this is and why this has happened is because this entire support, or supposedly this entire support base for AAP was not the support for us, but because the tussle between the BJP and the party does, which BJP had solved by the time the other civic polls had happened, and that is why you see the AAP getting nothing, just one seat out of that. So, you know, to say that a municipal election is a reflection of a general assembly or an election of a assembly, I mean general election or assembly election, is far-fetched dream, you know, in my opinion. I really don't buy that point.
Mr. Gadvi, we're going to try you now. Ms. Pandey कहती है कि this is a sapna. AAP is dreaming if it thinks about winning in Gujarat.
देखिए, पहली बात तो ये है कि गुजरात की जनता ने मन बना चुके हैं, तो पांडे जी कहे या कोई और, उससे कोई फर्क नहीं पड़ा। दूसरा, उन्होंने एग्जाम्पल दिया गांधीनगर के इलेक्शन का। मैं उनको और सबको, आप सब जानते हैं, बड़े हैं, लेकिन मैं आपको बता दूं कि ये निकाय का चुनाव होते हैं, उनके अलग होते हैं। अब दिल्ली का देख लीजिए, दिल्ली में 70 में से 67 सीट असेंबली में अरविंद केजरीवाल जी ला कर आए थे, और जो एमसीडी थी वो भाजपा जीती थी। अब चंडीगढ़ का आप देख लीजिए, उससे पहले आप पंजाब के जो हमारे अभी इलेक्शन लास्ट ईयर हुए थे पंजाब में निकाय चुनाव, तो उनका फर्क है। दूसरा, बीजेपी को आप लोग क्यों चुनेंगे? और हम ये नहीं कह रहे हैं कि बीजेपी बुरी है या कांग्रेस बुरी है या क्या कर रहे हैं, उनको हम ये जनता को ये मैसेज दे रहे हैं। अभी देखो, 3 दिन पहले 11वीं बार एग्जाम का पेपर लीक हुआ। अब कोई भी बच्चा है, कोई भी अपना बच्चा है, वो पढ़ता है, तो उनकी पेरेंट्स को ये लग रहा है कि मेरा बच्चा कोई एग्जाम में पास हो जाए, कोई उसकी नौकरी लग जाए। बीजेपी की ताकत ही नहीं है वो एग्जाम ले सके। पूरे पेपर फूट रहे हैं।
पेपर लीक होने के लिए से सारा वन शुड वोट आउट बीजेपी।
One second, let him finish and I'll come back to you.
नहीं, तो मैं ये कहना चाहता हूँ, लेट मी फिनिश। तो मैं ये कहना चाहता हूँ कि बीजेपी से लोग थक चुके हैं। दूसरी बात कि कांग्रेस यहाँ ऑलरेडी खत्म हो चुकी है। देखो, तीसरी पार्टी को अगर 6% से ज्यादा अगर कहीं पे भी वोट मिलते हैं, केरला में भाजपा को कभी 5% से ज्यादा वोट 25 साल में नहीं मिले, तो वहां उनकी एंट्री खत्म है। लेकिन आप देखो, दिल्ली में, पंजाब में, अब गुजरात में भी हमें 22 से लेकर 28% वोट मिले हैं निकाय चुनाव में। और जिस तरह से हमारा संगठन बन चुका है, 52,000 बूथ है यहाँ पे गुजरात में, उसमें 32,000 क्लियर हो चुके हैं। अभी भी हमारा संगठन है वो कांग्रेस से आगे बढ़ चुका है। ये बात अलग है कि भाजपा है वो यहाँ अपने सालों से, 27 साल से, तो पूरी मशीनरी ये सब कामें लग रहे हैं। लेकिन जनता जब तय करती है, तो आम आदमी अगर तय करता है, आम आदमी रास्ते पे आता है, एजुकेशन, हेल्थ अगर प्रश्न है, प्रॉब्लम्स है, तो आप मान लीजिए कि खास आदमी को घर पे बैठना है। आप पंजाब का एग्जांपल देख लीजिए, चन्नी जी, बादल जी, सिद्धू जी, सब घर पे बैठ गए, बड़ी बड़ी बातें करते थे, नहीं करते थे। तो मामला ये है कि गुजरात की जनता तय करने वाली है। और आम आदमी पार्टी, आज माननीय अरविंद जी और भगवत मान जी आए, आप उनका तिरंगा यात्रा में जनसैलाब देख लीजिए। तिरंगा यात्रा में लोग इतने रिस्पॉन्स भी दे रहे थे। तो उसका मतलब ये है कि गुजरात में अब लोग अपनी जनता की सरकार चाहते हैं, नहीं कि खास आदमी।
So there's a vacuum. You're saying there's a vacuum. There's an opportunity. There's a chance there for AAP, and you want to strike while you think you can strike while it's still hot. Ms. Pandey, quick response, and then I have one more question for Mr. Gadvi.
Okay, so I will go point by point. He spoke about the Janadhar and Jan Salab. You know, you showed in your own bites that how people were paid money to get the crowd and come here. So that's point number one.
Controversy. I'm not. We can't confirm that.
You showed it. You showed it. Anyway, second, Sara, I mean it's very important. एक सेकंड, मुझे बोल, आप बोल लिया, मैं बोल लेती हूँ।
Okay, Mr. Gadvi, just
तो पंजाब में आपने पंजाब का एग्जाम्पल दिया, तो लेट मी जस्ट टेल यू कि गुजरात और पंजाब में बहुत डिफरेंसेस हैं। डेमोग्राफिकली दे आर टू डिफरेंट स्टेट्स। केजरीवाल हैव बीन एबल टू हैव अ स्ट्रॉन्ग फुटहोल्ड इन दिल्ली एंड इन पंजाब बिकॉज ऑफ the help of the Sikh community, which is not there in Gujarat. Okay, that's point number one. Second thing is, and have a data, and you will see wherever Kejriwal has been successful, it needs it's a Congress-ruled state which has failed in delivering its promises. But when it comes to a BJP-ruled state, whether it was Uttarakhand, whether it was Uttar Pradesh, whether it was Goa, whether it was Northeast, or even in terms of South when he tried in the early years, he failed. He was,
okay.
you know,
Okay.
the deposit.
We are still 9 months away. We will continue to have this debate going forward. But, sir, I have a question for you. There's always this debate over who the face will be in Gujarat for the Aam Aadmi Party, because they will be taking on Prime Minister Modi. So some talk that, you know, you will be the chief ministerial face for the Aam Aadmi Party. Is that true?
देखिए मैडम का मैं 30 सेकंड में जवाब देना चाहूंगा कि उन्होंने कहा कि यहाँ गुजरात है, बिल्कुल गुजरात है, और गुजरात 2017 में चला जाता, 99 सीट पे आ गया था, 92 चाहिए यहाँ 182 में से, इसलिए गुजरात बहुत अच्छी तरह से हम समझ रहे हैं। दूसरा कि फेस तो जनता है, और हम जब चुनाव नजदीक आएंगे तो जैसे पंजाब में डिक्लेयर किया वैसे डिक्लेयर भी करेंगे। और रही बात हमारी, तो हम सब आम जनता है, आम आदमी है, और गुजरात की जनता तय करेगी कौन फेस हो।
All right. Mr. Isudan Gadvi and Sujata Pandey, thank you both for joining us. And of course, we'll come back to you. Gujarat is going to be in the headlines for the next few months. Thank you so much. I want to quickly just touch upon the other big international story at this hour. 36-hour curfew has been announced in Sri Lanka as a state of emergency has been enforced amidst violent protests against food and fuel shortages. Now, this move, I'm talking about the curfew, has been aimed at stopping new protests, and it comes 2 days after crowds set vehicles ablaze near the president's private residence. The military has since been deployed. It has the power to arrest anyone without a warrant. This is Sri Lanka is in the midst of a major economic crisis. My colleague Shrija is there in Colombo. She joins us. Shrija, the curfew has now come into play. Where are you? How are you? What do you see around us? Give us an update. Your eyes on the ground there in Sri Lanka.
Well, it's been a few hours that the curfew has come into place. Now, this will remain active till Monday 6 a.m. So what we can show you on ground, we are reporting from Colombo, and right behind me are shops. The shutters have been brought down. There's very limited traffic. You're not really looking at much of private vehicles, especially on the move. We are only looking at heavy vehicles and also some of the taxis that are constantly on the move. So we are also looking at some of the shops are just bringing their shutters down at the moment. Just about 1 or 2 shops that have, kept it open. But yes, as far as the government is concerned, what we are also understanding from a highly placed sources is that it could be one of the reasons why they had to bring in the curfew here is tomorrow is going to be a very big day. Now, that was planned by a lot of protests, especially organizers here across Sri Lanka. They were planning to organize major protests in the major cities in Sri Lanka, the country Sri Lanka tomorrow, and to clearly keep the protesters at bay so that they cannot mobilize them in huge, large numbers. We see the government immediately had to impose this curfew. So people are, when you're looking at what's really happening here on ground, people are going home, and there is checking that's happening at various checkpoints, vantage points. Police have been deployed. There is checking happening. Also, they are asking people questions like why it's been so late. So these are the things that we are witnessing on ground. But that apart, what's really available and what's not, we see essential services will be functioning, and this includes pharmacies and hospitals as well. But whereas fuel stations will remain shut, now that's something that we are hearing, and also shops and grocery stores and supermarkets. So that's exactly the reason what we witnessed today was panic buying at supermarkets, and also we saw long serpentine queues, especially people waiting right outside cooking gas centers. And when we spoke to them, they also tell us that they've been waiting, they've been going home and coming back for the last 7 days, and they've just got it lucky today when they got especially the cooking gas cylinder nearly after 7 days. So there was some sort of rush that we had witnessed. But as it is, if you're talking about fuel at various fuel petrol stations, we did witness even today, though the shipment had arrived at the Sri Lankan shores, nearly 40,000 metric tons, we continue to see queues right outside fuel stations.
Well, hopefully that fuel will get to those who need it the most. Thank you so much, Shrija, and stay safe, and we look forward to more of your reports. That's it on Left, Right and Centre.